Depression is a mental health disorder that affects a person's mood, thoughts, behavior, and overall functioning. It can cause persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in activities that were once enjoyable. Here's a breakdown of key aspects of depression. 1. Symptoms of depression. Emotional symptoms. Persistent sadness or empty feeling. Feelings of hopelessness or worthlessness. Irritability or frustration, even over small matters. Loss of interest or pleasure in hobbies or activities. Feelings of guilt or self-blame. Physical symptoms. Fatigue or lack of energy. Changes in appetite or weight, increase or decrease. Difficulty sleeping or oversleeping. Aches or pains without a clear physical cause. Slowed movements or speech. Cognitive symptoms. Difficulty concentrating, making decisions, or remembering things. Thoughts of death or suicide. 2. Types of depression. Major depressive disorder, MDD, characterized by a long-lasting and intense feeling of sadness or a lack of interest in daily activities, disrupting normal functioning. Persistent depressive disorder, PDD, or dysthymia, a chronic form of depression lasting for at least 2 years, but with less intense symptoms than MDD. Bipolar disorder, involves alternating periods of depression and mania, extremely high moods. Seasonal affective disorder, SAD, depression related to changes in seasons, typically during the fall and winter months when there is less sunlight. Postpartum depression, depression experienced by some women after childbirth, often linked to hormonal changes. 3. Causes of depression. Biological factors, genetic factors, changes in brain chemistry, hormonal imbalances, and certain medical conditions, like thyroid problems, can contribute to depression. Psychological factors, past trauma, abuse, or a history of mental health issues can play a significant role. Environmental factors, stress, difficult life events, e.g., loss of a loved one, relationship issues, financial problems, or lack of support systems can trigger depression. Social and cultural factors, social isolation, stigma, and societal expectations can also affect the development of depression. 4. Treatment options. Psychotherapy. Cognitive behavioral therapy, CBT, a type of therapy that helps individuals recognize and change negative thought patterns. Interpersonal therapy, IPT, focuses on improving interpersonal relationships and resolving social difficulties. Psychodynamic therapy explores how past experiences influence current feelings and behaviors. Medications. Antidepressants like SSRIs, selective serotonin reuptake inhibitors, SNRIs, serotonin norepinephrine reuptake inhibitors, or tricyclic antidepressants, TCAs, are commonly prescribed. Medications can take time to work, and it's important to work closely with a healthcare provider to find the right fit. Lifestyle changes. Regular physical activity and a healthy diet can improve mood. Adequate sleep and reducing stress are also important in managing depression. Building a support network of family, friends, or support groups. Other therapies. Electroconvulsive therapy, ECT, used in severe cases of depression that don't respond to other treatments. Transcranial magnetic stimulation, TMS, a non-invasive procedure that stimulates parts of the brain involved in mood regulation. 5. Self-care and coping strategies. Regular physical exercise, even a walk, can help improve mood. Mindfulness, relaxation techniques, or meditation may reduce stress. Journaling and talking with supportive friends or family can provide emotional relief. Limiting alcohol and drug use, as these can worsen depressive symptoms. 6. When to seek help. If you experience persistent feelings of sadness, hopelessness, or thoughts of self-harm or suicide, it's important to reach out to a mental health professional. Early intervention can improve the chances of recovery and help prevent symptoms from worsening. If you or someone you know is struggling with depression, please don't hesitate to seek help. Talking to a doctor, therapist, or counselor can provide valuable support and guidance in managing symptoms.